The young lady is going to describe her symptoms of post-traumatic stress disorder, PTSD. Some classic examples of those symptoms to keep an eye out for, or re-experiencing things like nightmares or flashbacks, avoidances such as not wanting to think about what had happened, not going to places that remind her or trigger that memory, and then a lot of hyper-vigilance and looking around and being suspicious and uncomfortable and jumpy.
I'm 25 years old now, but when I was 15 and a half, I was raped. My parents owned a country western line dance business. Every weekend we'd go out to different spots in the community and teach country western line dancing. Along with that, we needed music, and the DJ would provide that. And we became friends. My family and I became friends with this DJ. One night while we were having a dance, after the dance had ended, we all decided to go out to a diner to have to eat something, and the DJ said that he would take me to the diner, which wasn't very uncommon at all. So he packed up his things and we got into his truck and started heading off towards, well, just away from the dance hall, but not in the direction that I thought he might, would be easier to go. And he pulled into a gravel parking lot that was very dark. And around that parking lot, there was a wooded area with pine trees and a lake in the center of the wooded area. It was at that time that I looked at him and I told him we were not in the right spot, and that my parents were expecting me to be at the diner, and his eyes got very cold and harsh and gray and clouded over, and he didn't really want to listen to anything I had to say. And when I reached for the door to try and get out, he pulled it shut. And that night is when he raped me. But the next thing I remember is getting back to my mom's house. And still no one was there. They must have still all been at the diner. And he opened up the truck door and pushed me out the passenger side. And just before he let me walk back up to my mom's, up to the doorstep, he pulled me back by my shirt and he said that if I would tell anyone what happened, he'd come after my 5-year-old sister. So I knew when I went to the house that I wasn't going to tell a soul. So I went upstairs and got into my pajamas and went to bed. And my mom checked on me that night because she was concerned that I didn't show up at the diner. And I just told her I was sick, wasn't feeling well, and I just asked him to bring me home, and she left it at that.
What happened for the next 5 years after that happened to you?
I tried to forget about the incident. In fact, I was successful. I pushed it away because there was no way I was going to tell what happened and put my sister's life in jeopardy. I just went on like normal, or what I thought was normal.
Were the things that you were avoiding?
Was I ever? Yes, I avoided everything. I avoided friends. I was distancing myself from friends and family. I avoided things. Well, it wasn't until later through the treatment that I realized I was avoiding things that because of the rape. For example, things like the smell of pine. Whenever I smelled pine, I panicked, and so I would avoid that. The telephone, because he then would frequently call the house after the rape occurred, so I wouldn't pick up the telephone, nor would I use it. The cold and the dark, country music, I couldn't even listen to it anymore. Then when I went on to college, that's when I started, I would say is when I really started to spiral downward.
What were some of the symptoms that you were experiencing at the time?
I was nervous, I had anxiety, I had flashbacks, nightmares, were reoccurring. What I remember the most was a figment of a man that would show up in the room with me, and then when I'd look, he wasn't there. I was very cautious of people that were behind me walking in the street, and I would always look over my shoulder. Loud noises, barking of dogs would make me jump. I'd have panic attacks, and I wouldn't know where they were coming from or how to deal with them. And I started drinking heavily, very heavily, partying every night. This is, I would say, my sophomore year in college. And I started getting into recreational drugs. Like I thought if I just did marijuana it would take the pain away, but then that marijuana wasn't enough, so then I went to more. And it got to the point that I didn't feel like life was worth living. And I had tried several times. I was just cutting myself for a while and just cutting my legs to take some of the pain away. But that still wasn't enough, so then I tried to kill myself a couple of times, but it wasn't until the third time that I realized that I might have needed help. The last attempt to take my life, I had found my boyfriend at the time, I had found his handgun. That was loaded because he kept it loaded. And I knew this. I found the gun when everyone was asleep and took it into the bathroom. And I even pulled the trigger, but I didn't know how a gun worked. And I didn't realize that there was a safety on a gun, so I didn't know to take it off. So pulling the trigger did nothing. But after the time I had realized to take the safety off, and I was going to pull the trigger again, my dog had walked into the bathroom. And it made me stop and think. And it sounds silly that a dog would make you stop and think about your life, but for some reason I felt that this dog needed me to be there. So I put the gun down and I walked in and I realized I needed help. My mom started asking me what had happened, why I decided to do this, what has changed. She just wanted some answers that I didn't think I could provide, but all of a sudden it came flooding back to me, all of the memories of what happened. And I think it's probably because my little sister was in the room, who now was 10 at the time. And she just kept probing and probing until I felt like I had no choice, and I told her I was raped. And immediately she started finding ways to help me and find treatment. When my mom was first looking for ways to treat the emotions and the feelings that I was going through, she didn't know what to do, and I didn't know what to do. So she took me to a hospital, and they placed me in their psych ward for a little close to 2 weeks. That time that I was there, she was researching places then that I could go to work on specifically my symptoms of PTSD. During the time that I was at the psych ward, I was on antidepressants because I was suicidal, very suicidal at that time. But 3 months later, when I started the treatment for PTSD specifically, I was on a maintenance level of antidepressants.
Describe the treatment and how did it work for you?
The treatment was a 12-week program, and I would go once a week. The therapist and I then started working on reliving the experience. And this was done in the therapist's office, and I was asked to go over the story. Through that, she would tape these sessions, and I would take them home and listen to this tape. And although I might have the urge to stop the tape, I was encouraged to keep it on. Early on in the treatment, the therapist and I worked on a list of things that I found I was avoiding. Friendships, telephone, answering and making calls, wooded areas, the smell of pine, and large bodies of water, like a lake, and very cold temperatures would make me sick to my stomach. I was then asked, as part of the treatment, to place myself in these situations that I was avoiding and work through the anxiety. One of them was going back to the lake that the rape occurred at, smelling the pine, and being there. I first did this with my mom, and then eventually through the course of the treatment, I was able to go back to that lake on my own. One of the hardest things for me to do was go back and line dance, since I felt that's where the whole thing originated. And even through this course of the 12-week treatment, I was even able to go back and line dance.
Can you tell us a little bit about how the PTSD interfered with your intimate relationships?
Before the treatment, I was not intimate at all. I avoided it. Although I was with a man at the time, a steady boyfriend, it brought back too many memories, and although I wasn't relating it to the rape, it was just not something that I felt comfortable doing. After the treatment, although I was cautious of who I was getting involved with, I spent a lot of time by myself so that I could find out who I was, and it was like relearning myself all over again. So I wasn't intimate, but I didn't have a problem with it. So if I found the right person, it wouldn't have been a problem. And then it was about 3 years after the treatment. I guess I had small relationships with men and would get intimate with them, but nothing of any substance. Then I found my husband 3 years later, and now we've been married for almost 2 years, and things are fine, and I'm very comfortable, and especially comfortable becoming intimate with him.
Do you still have some symptoms today? And if you do, how do you deal with them?
I find that when I get myself into a position, either I've just moved and I'm nervous because of that move, and I don't have friends right now, and it's a new house and I'm a little scared. I have a little anxiety that builds up, and some of the old symptoms come back. For example, the figment that I see of that man came back a little bit, and some of the nightmares came back. I was able to think about it, breathe. We were taught through the therapy treatment to breathe and realize that it is a safe place, and nothing's really going on. That it's just, I'm just rethinking about what happened. And then I try and tell the story to someone, whether it's my husband or a friend, a close friend that I can trust, and work through the experiences that I'm feeling.
This is a classic case of post-traumatic stress disorder, and the description that you just heard includes the classic symptoms to look for. Those would be the re-experiencing symptoms, the avoidances, which are very, very prominent, and some hyper-arousal and jumpiness. Not all people who've had trauma develop post-traumatic stress disorder. As a matter of fact, most people do not, but the large minority that do develop it will have those symptoms that you've just seen described. And without treatment, post-traumatic stress disorder can become chronic and very, very debilitating to the person's life.